Tuberculosis, TB, is a chronic granulomatous inflammation caused by Mycobacterium tuberculosis. Although pulmonary tuberculosis is the most common form, TB can affect various organs throughout the body. The hallmark of the disease is the formation of tuberculosis nodules accompanied by varying degrees of caseous necrosis. What are the early symptoms of tuberculosis? TB bacteria can infect multiple body parts, presenting with different symptoms. In its early stages, TB may be asymptomatic or manifest as mild symptoms related to the affected organ. Additionally, patients may experience common systemic symptoms such as low-grade fever, night sweats, and fatigue. Respiratory tuberculosis, early symptoms may be absent or present as a mild dry cough. If the pleura is involved, the cough may be accompanied by chest pain that worsens with breathing or changes in position. Genitourinary tuberculosis, early stages may show no symptoms, or present with urinary frequency, urgency, and pain. Gastrointestinal tuberculosis, early symptoms may include abdominal discomfort, occasionally presenting as intermittent cramping, commonly in the lower right abdomen or around the navel. Symptoms often worsen after eating and improve after bowel movements. Genital tuberculosis, in the early stages, there may be occasional discomfort in the rectal or perineal area. Bone and joint tuberculosis, since bones are sensitive to pain, early stages may involve pain at the affected site, which can worsen with movement. Pain can also restrict movement. TB is primarily transmitted through the air when an infected person coughs, sneezes, laughs, or talks, releasing droplets containing Mycobacterium tuberculosis into the air. Certain types of pulmonary tuberculosis, especially those with positive sputum smear, indicating the presence of TB bacteria in the sputum, are highly infectious. Droplet transmission is the most significant mode of TB spread, while transmission through the digestive tract or skin is now rare. How prevalent is tuberculosis in the population? TB is a long-standing and significant public health issue that continues to threaten human health. In 2018, there were approximately 10 million new cases of TB worldwide, with an incidence rate of about 130 cases per 100,000 people. TB is one of the top 10 causes of death globally. In 2018, the estimated number of TB-related deaths was approximately 1.491 million, including those with HIV, with a mortality rate of 19.62 per 100,000 people. High-risk groups for tuberculosis include individuals with weakened immune systems, such as those with HIV/AIDS, those on immunosuppressive medications, patients starting anti-TNF treatment, dialysis patients, those preparing for organ or blood transfusions, and those with silicosis. Prisoners, healthcare workers, immigrants from countries with high TB burdens, the homeless, and individuals who use illicit drugs. The elderly, 65 years and older, and those with chronic diseases are also at higher risk. Diabetics are considered a high-risk group for TB. Students and workers in crowded public settings like schools and factories are also at increased risk due to the potential for TB transmission in these environments. How to prevent tuberculosis? Vaccination with BCG, one effective method for preventing tuberculosis, TB, is the early administration of the BCG, Bacillus calmette-guerin, vaccine. Getting vaccinated shortly after birth can reduce the risk of TB infection and disease. Avoid close contact with TB patients. TB bacteria are released into the air when an infected person coughs or sneezes. To minimize the risk of infection, it's important to avoid close contact with individuals who have tuberculosis. Maintain good ventilation. TB bacteria can survive in the air for extended periods. Ensuring that indoor spaces are well ventilated can help reduce the risk of TB transmission. Practice healthy lifestyle habits. Adopting good daily habits can strengthen your immune system and help prevent TB. This includes maintaining a balanced diet, engaging in regular exercise, and getting adequate sleep.